So first we'll start with skeletal. So our study of the skeletal system, that's going to begin with an overview of its function. So we classify bones by their structure and then describe the characteristics of a typical bone. The skeleton provides the internal framework of the body, much like a tent has poles that maintain the structure of that tent. Our skeletal muscles will be attached to the bones, and internal organs are going to be found within cavities that are surrounded by bones and skeletal muscles. So the skull will protect the brain and the ribs, as well as the breastbone. And then the breastbone will protect vital organs within the chest, which are your heart and your lungs. Bone will also contain bone marrow that produces red blood cells that transport oxygen, and then have several different types of white blood cells that will protect the body from disease. Bones will play an important role in maintaining what's known as homeostasis of blood calcium. And then that blood calcium is going to be a vital substance that is required for normal nerve and muscle function. They will serve as a safety deposit for calcium as well. When the amount of calcium in the blood exceeds its normal level, then calcium moves out of the blood and into the bones for storage. Conversely, when blood calcium decreases to a level that is below normal, then our calcium will move in the opposite direction. So the balance of calcium deposits and withdrawals to and from the skeleton will be regulated by a delicate balance of hormones. So for example, calcitonin, that is going to be from the thyroid gland, and it will increase mineralization of bone, thereby reducing our blood calcium levels. The parathyroid hormone, that is going to be from the parathyroid gland, and it will counterbalance the effects of that calcitonin by decreasing calcium in the bone. Therefore, it will increase the blood calcium levels. The cavities inside some of the bones will also store fat. And then the term homeostasis, that is going to be used to describe the process of blood cell formation. You have a combination of two different Greek word parts, hemato, meaning blood, and then poiesis, meaning making. So our red blood cell formation is going to be a vital process that's carried out within our red bone marrow. The red bone marrow is going to be soft connective tissue inside the hard walls of some of our bones, and that will produce both red and white blood cells. Now, you do have four major types of bones, and they will be classified according to their overall structure. So the names will their shape. So our long bones will, an example is going to be the humerus that's found in the arm. The short bones are going to be found in the wrist, and they are carpets. Flat bones, one of them will be found in the skull, and it's going to be like that frontal portion of the skull. Your irregular bones, these will be found within the vertebrae, so they're what makes up the spinal column. And then some scientists will recognize an additional category called the sesamoid bones or round bones. And so those will sometimes develop within a tendon. Now, an example, really the only one that we have normally, now some people will develop additional, but the only one that we will normally have is going to be that sesamoid bone. An example of the sesamoid bone is going to be the patella or the knee. And that will develop within the patellar tendon. So many important bones in the skeleton are going to be classified as long bones, and all of the bones in the body are going to have several different characteristics. By studying the typical long bone, you can become familiar with the structural features of the entire group of human bones. So your diaphysis, or the shaft, that's going to be a hollow tube that's made of hard, compact bone. Therefore, it's going to have a rigid and strong structure that's light enough in weight to permit our easy movement. The medullary cavity, that's going to be a hollow area inside the diaphysis of a bone that contains yellow bone marrow, which is going to be in an active fatty form of marrow that's found in the adult skeleton. The epiphyses, that is going to be at the end of a long bone. So the red bone marrow will fill in the small spaces within that spongy bone that's found within that epiphyses. Some yellow marrow may appear as a person ages, but in the prime and majority of what's going to be in there is going to be that red bone. Articular cartilage, that's going to be a thin layer of hyaline cartilage that covers each of the epiphyses. It'll function like a thin, smooth rubber cushion would if it were placed over the ends of the bone where they form that joint. Your periosteum, that's going to be a strong membrane of dense fibrous tissue covering a long bone everywhere except for at the joint surfaces. And then there it's going to be covered with articular cartilage. And then lastly, you have the endosteum, and that's going to be a thin membrane that lines that medullary cavity. Our flat bones, such as the sternum, the ribs, and many of the skull bones, those are going to have a more simple structure than most of our long bones. So flat bones are going to have a layer of cancellous bone between the outer layers of your compact bone. And then that cancellous bone, that is going to be known as the diplo. Now, the bones of the skeletal system will contain two major types of connective tissue, bone and cartilage. So our bone tissue is going to have different microscopic structures depending on its location and its function. The outer layer of the bone will be hard and dense, and the bone of this type is also known as compact bone. So compact bone is going to appear naked to the eye. However, the porous bone tissue on the inside of the individual bones, that's going to be called that spongy or cancellous bone. As the name implies, our spongy bone will contain many spaces, kind of like a bath sponge does. The cavities are going to be filled with red or yellow marrow, and the beams that form the lattice of the spongy bone, those are going to be called trabecula. With our compact bone, the extracellular matrix is organized into numerous structural units called osteons. And each circular and tube-like osteon is going to be composed of calcified matrix that is arranged in multiple layers that resemble the rings of an onion. Each of those rings is going to be called concentric lamella. And the circular lamella, those will surround the central canal, which contains our blood vessels. The central canals are going to be connected to each other by transverse canals. And then our cartilage bone, that will resemble and differ from bone itself. As with bone, it does consist of intracellular substances, or I'm sorry, it consists more of our intracellular substances than just cells. Innumerable collagenous fibers will reinforce the matrix of both of those tissues. However, in cartilage, the fibers that are embedded in a firm gel instead of in a calcified cement substance they are going to be found within the bone. As a result, cartilage has the flexibility of a firm plastic rather than the rigidity of a bone. Those cartilage cells, which are known as chondrocytes, those are going to be located in the lacunae. In cartilage, the lacunae are going to be suspended in the cartilage matrix, which are much like air bubbles within a block of Swiss cheese. And because there's no blood vessels found within the cartilage, then the nutrients must diffuse through the matrix in order to reach those cells. When
I step away for a minute, my daughter just
you're fine.
snapped her face off or something.
Yeah, you're fine. You're fine.
Okay, I'll be right back.
When the skeleton begins to form in a baby before its birth, it consists of not bone, but of cartilage and fibrous structures that are shaped like bone. Gradually, these cartilage models will become transformed into real bones when the cartilage is replaced with calcified bone matrix. This process of consistently remodeling and growing bone as it changes from its small cartilage model to the characteristic shape and proportion of the adult bone, that's going to require continuous activity by those bone forming cells that are called osteoblasts, and then those bone cells themselves called osteoclasts. And then this process as a whole, that is what's known as endochondral ossification. Now, our human skeleton has two different divisions, the axial skeleton and the appendicular skeleton. So bones of the center or the axis of the bone or of the body will make up what's known as the axial skeleton. So the bones of the skull, spine, and chest, as well as the hyoid bone in the neck, those are all known as the axial skeleton. So on this little chart over here, anything that's in blue, that's what's known as the axial skeleton. So the skull, that will consist of 8 bones that form the cranium, 14 bones that form the face, and then 6 tiny little bones in the ear. You can study the names of all of these later if you know that's light reading that you want to do on a Tuesday night. But we're not, for the sake of Med-Term anatomy for coding, we don't have to know the names of all 206 of those bones. Okay. But if you want to know the names of all of them and study them, they are on page 120. The hyoid bone, that's going to be located in the neck, where it serves as an anchor for tongue muscles, and then it helps support the larynx or also the voice box. And it does resemble the Greek letter upsilon. Now, your vertebral column, that consists of 24 separate vertebrae that are connected in a way that they form a flexible curved rod. You're going to have 3 sections of the spinal column, which are known as the cervical region, the thoracic region, and the lumbar region. 12 pairs of your ribs, the sternum, and the thoracic vertebrae. That's going to form the bony cage that's known as the thorax or the chest. And then each of the 12 ribs is going to be attached posteriorly to the thoracic vertebrae. Also, all of the ribs, except for the lower 2, those are going to be attached to the sternum. So they do have anterior and posterior anchors, and then the bottom 2 are going to be floating ribs. The appendicular skeleton, that is going to consist of 126 of the 206 bones that form the skeleton as a whole. The bones of the upper and lower extremities, those will make up the appendicular skeleton. That does consist of the bones of the upper extremities, so the shoulder, pectoral girdles, arms, wrists, and hands, and then the lower extremities, including the hip and the pelvic girdles, as well as the legs, ankles, and feet. It is important to note that the bones in the shoulder and the hip girdle do connect the bones or the arms and the legs, respectively, to the axial skeleton. The humerus, that's going to be the long bone of the arm, and it's also going to be the second largest bone in the body. It's attached to the scapula at its proximal end, where it is going to help hold it in place, and it is helps permit to move by a group of muscles that together are called the rotator cuff. At the distal end of the humerus, it articulates with the 2 bones of the forearm, which are the radius and the ulna. And then the wrist and hand have more bones in them for their size than any other part of the body. So you have 8 carpal bones, which are the wrist, 5 metacarpal bones that support the structure for the palm, and then 24 phalanges or fingers. So just as the humerus is the longest bone in the arm, the femur is going to be the longest bone in the thigh, as well as the longest bone in the entire body. Distally, the femur articulates with the kneecap or the patella, and the tibia and the fibula. The foot bones are going to be similar to the hands, and their names are also going to be similar. So you have metatarsals and tarsals. So you have 5 metatarsals in each foot and 7 tarsal bones. And then the largest tarsal bone is going to be known as the calcaneus, and that is also the heel bone. Many different factors will cause each individual skeleton to vary from any other skeleton. So a man's skeleton and a woman's skeleton will differ in many different ways. If you were to examine a male skeleton and a female skeleton that's placed side by side, you would probably first notice the differences in their size. Most male skeletons have bones that are larger with more distinct bumps and other markings. So this results partly from the differences in muscle tension on bones and the tension, and so therefore the more tension on the bone, the bigger and denser than those bones, those bumps get at the point of muscle attachment. The most obvious of the many structural differences between the male and female skeleton will be the pelvic girdle. So the ring that's formed by the two pelvic bones as well as the sacrum. The wide structure of the female pelvis allows the body of a fetus to be cradled in it before birth, and then its wide opening allows the baby to pass through it during birth. A man's pelvis is going to be shaped more like a funnel than the broad, shallow basin of the female pelvis. During childhood and adolescence, the bone of the skeleton will enlarge and become more ossified, and the human skeleton is considered to reach its mature state around 25 years old. From then until about age 50 or so, the skeleton is going to be in an active state of maintenance where it continuously remodels itself, so it'll dissolve and rebuild that bone tissue. An elderly person will weigh much less than it did in its younger years because the density of the bone will decrease. Among the many factors that can cause variation in one skeleton is nutrition. So without enough calcium and vitamin D, especially during the development years, then the skeleton may not reach its full potential of growth, or it may show signs of early degeneration. The load bearing or mechanical stress of using the skeleton affects how bone tissue is remodeled, and an active older person can reverse much or all of its bone loss that is associated with aging. The term joint, that's going to be borrowed from carpentry, where it refers to the structure formed when pieces of wood are joined together. In anatomy, a joint is going to be the structure formed when bones join together, and then joints are also known as articulations. Every bone in the body will connect to at least one other bone, with the exception of the hyoid bone. Joints will hold our bones together securely and at the same time make it possible for movement to occur between those bones. Without joints, we can't move our arms and legs, or even really our upper torso. We can't move at all. So joints are going to be classified into 3 different types according to the degree of movement that they have. First, you have the synarthroses, which is a joint in which no significant movement occurs. The functional characteristic is produced by the fibrous connective tissue between the articulating bones, and that holds them together tightly. The joints between the cranial bones are going to be synarthroses, and they're commonly going to be called sutures. The amphiarthroses, that's going to be a joint in which only slight movement is possible. They will typically be made up of cartilage, which joins the bones tightly, but they will often have slight flexibility. So the symphysis pubis, that's going to be the joint between the 2 pubic bones, that's going to be known as an amphiarthrosis. And then your diarthroses, these are going to be joints that allow considerable movement, sometimes in many ways and sometimes in only 1 or 2 directions. Most of our joints that we have in the body are going to be our diarthroses. All will have a joint capsule, a joint cavity, and a layer of hyaline cartilage over the ends of 2 joining. The joint capsule is made up of this body's strongest and toughest material, fibrous connective tissue, and it's going to be lined with a smooth, slippery synovial membrane. The capsule will fit over the end of the 2 bones, somewhat like a sleeve. Because it attaches firmly to the shaft of each bone to form its covering, the joint capsule will hold the bones securely together, but at the same time, it will permit movement at the joint. The structure of the joint capsule will help make possible the joint's function. Ligaments will also grow out of the periosteum and join the 2 bones together even more firmly. The layer of cartilage over the joint will end, or the joint ends of the bones will act like a rubber heel on a shoe. Therefore, it's going to absorb those jolts. The articular cartilage also provides a smooth surface, so when the bones of the joint can move with little friction. A joint cavity where the bones join together is going to be lined with a synovial membrane, which is secreted, or which does secrete a lubricating fluid that allows easier movement with less friction. In some of our joints, the synovial membrane will form a pocket-like extension or pouches that are filled alongside a joint. That's going to be known as the bursa, and it's a pocket of fluid that acts as like a shock absorbing cushion around the bones of the joint. You do have different types of diarthroses for joints. In a ball and socket joint, a ball-shaped head of one bone will fit into a concave socket of another bone. Shoulder and hip joints, for examples, those are going to be our ball and socket joints. Of all of the joints within our bodies, these will have the widest range of motion. Hinge joints, like the hinges on the door, those allow movements in only two directions, mostly flexion and extension. A pivot joint is going to be those in which a small projection of one bone pivots in an arch of another, and this permits rotation of the head, which rests on the axis. Only one pair of saddle joints will exist within the body, and because the metacarpal bone of each thumb and the carpal of each wrist, those will have articulating surfaces of those bones that are saddle shaped. So therefore, it's going to make possible the thumb's motility, basically that opposing thumb that no other animal has, and they're able to position. Your gliding joints are going to leave the movable diarthrotic joint. So they're flat articulating. I'm sorry, they are going to be the least movable of the diarthrotic joints. Their flat articulating surfaces allow limited gliding movement, such as the superior and inferior articulating processes between successive vertebrae. And then lastly, you have your condyloid joints, and those will be in a condyle that fits into an elliptical socket. So an example of this will be the distal end of the radius that fits into depressions in the carpal bone. So here we have different types of joint movement. So your flexion, that just means that the angle itself reduces. So if you bend your elbow, then that is going to be a flexion. An extension is going to be where it increases the elbow. So if you have your joint, your arm moved in, your extension is going to be taking it out. So you're increasing that angle. Abduction is going to be to move it away from the midline. So if you raise your arm up, you're moving it away from this midline, your elbow, because as you go down, which is your adduction, you're moving your elbow closer to the midline. Rotation just means that you have one bone that bends relative to the other. So basically just a rotation. And then your circumduction is going to move the distal end of a bone in a circle, and your proximal end relatively stable. So whenever you hold your arm up and you kind of like move your arm, then your proximal end, which is your elbow, is going to stay put, and your distal end, which is your fingers, is going to move. Does that make sense? Okay. So then we have our pathology of the skeletal system. I'm not going to go super deep into each one of these because we'll study the pathology a little bit closer whenever we get into ICD-10 as well. But they are here as, as far as just to show different ones. The most common ones that you'll see will be bursitis, which is just the inflammation of the bursa. Remember that bursa is going to be that fluid-filled sac that's within the joint. Your sprains, which will be the ligament that contains the bone, then it's wrenched or torn. So it's kind of just like twisted a little bit. Your dislocation is going to mean that entire bone has come out of its joint. And then your subluxation is just a partial dislocation. So it's not completely out of socket, but it is like not where it should be within that joint. Oh, arthritis. I have unfortunately way too much of it at my age, but your osteoarthritis, it's just wear and tear. So essentially you can have osteophytes, so which are basically just your bone spurs that happen. A lot of people will get them in their feet or in like their neck and their back. Gout or your gouty arthritis, that's just going to be where you have deposits of crystals in the joint. So it essentially is just a buildup of those crystals, and it just kind of it leaves more of like bumps on your fingers is where you'll see it the most. Your rheumatoid arthritis is going to be an autoimmune disorder. So it will attack some of your joints and then as well as some organs. Those are the three biggest ones I think that you'll see is the osteoarthritis, which is just your generalized gouty arthritis, which is typically in your hands, and then your rheumatoid arthritis. Now, within the spinal column, you do have some herniated discs. So sometimes they can actually slip and move out of, the area, or they could rupture and just not hold, kind of like their donut shape that they have. They can just not hold that shape and then just slide out. Spinal stenosis is just the narrowing of the spaces within the spine. If you see the term lumbago, that is just your low back. And then you've got different curvatures of the spine. So your kyphosis is a hunchback. So exactly what we think of. A lot of your older people will end up with kyphosis. Lordosis is going to be a sway back. So instead of going forward, then your back is going to go backwards, and you're like it'll be like your chest is sticking out because that sway back, your curvature is going to go forward. And then your scoliosis is going to be your lateral. So it's going to kind of go this way instead of front or back. It's going to sway more to the side. And then osteoporosis and osteopenia. So osteoporosis is going to just be a marked loss of bone density, whereas osteopenia is going to just have thinner bone density versus it being there and then we've lost it. Osteopenia is just going to be it's been there and it's always been lower than average. Fractures, again, this is not something that I'm going to go completely into depth with because when we get into ICD-10, we will have very specific codes for different types of fractures. But this slide is here and then it's also in your textbook. So if you guys do need, like if you want to see pictures of it, it's all in there. And then like I said, we'll cover it whenever we get into ICD-10. But I didn't, so let me just touch on a couple of them real quick. So your closed fracture just means that there's no wound in the skin. So it literally will just look like your skin is the only thing holding whatever in place. Your open fracture is just any type of fracture that is complete that the skin has actually broken as a result of the break, not a scratch and then there was a break. And then the other big ones that we'll see are going to be like the pathologic fractures. So if someone has osteoporosis or cancer or something that weakens that bone, that let's just say I am a very klutzy and ditzy person and I may or may not hit my shoulder or my arm on the door frame all the time as I walk through. My bones are not weak and they haven't lost the density, so I can withstand that. But someone that has a pathologic fracture just means that it breaks underneath that normal strain. So if I had osteoporosis, I'm at risk of bumping into a door frame and, like breaking my shoulder or breaking my arm or my wrist or my hand. And then some of our diagnostic procedures, for the skeletal system are x-rays. We all know what x-rays are. We've got bone density testing, so it can determine the loss or the change within that bone density. You've got some ultrasonic bone density testing. So instead of using, like a CT or an MRI to tell that bone density or an X-ray, they can actually do it with an ultrasound. And then your DEXA scan. Those are going to be the ones that most of your older women will get, or someone that is that has potentially that lower. They will do those DEXA scans, and that will give you very accurate results on how dense any of your bone tissue is. And then as far as some treatments go, so your stem cell and bone marrow transplant, you do have certain types of cancer, such as your leukemia and your lymphomas, that are very receptive to that. And then as far as your transplant goes, you can have your allogenic, which comes from someone else, or an umbilical cord sourcing. Autologous means that it comes from your own person after it, gets cleansed, and then they, make sure that none of the cancerous cells are there, and then they'll retransplant that back into you. And then peripheral is the patient's own blood forming stem cells from a patient's bloodstream or a donor. So they may transplant it into the donor, and kind of let it do its magic and then come back. And then we've got some joint procedures and joint replacements. So ACL reconstruction. So if you have that ACL within the knee that is ripped or torn, they can do a reconstruction with that. A lot of surgeries that they do on your joints now are done arthroscopically. So it's minimally invasive, where they only have 2 or 3 small incisions. And then they basically, can work miracles with those anymore. Your joint replacements themselves. So arthroplasty is just going to be the repair of that damaged joint versus your actual total knee replacement, total hip replacements, your shoulder replacement. So basically anything that has a joint, any joint within your body can now be replaced, essentially. Within our spinal column, if you have phantom limb pain, so basically someone that has an amputation, but yet those nerves still run from the spine, that phantom limb pain is real. It, basically convinces the person that even though my leg is cut off, I still have pain and that leg is still there. So you'll see a lot of that when there's been traumatic amputations. Discectomies and vertebroplasties, those are going to be on the disc and the vertebrae that are within the spinal column. Spinal fusions, they'll just immobilize part of the spine by fusing multiple vertebrae together. Decompressive craniectomies, so they will actually remove a portion of the skull if that intracranial pressure is increased too high. Craniotomies, basically they will just do just an opening into the skull. So the difference between the craniectomy, they actually remove that skull, versus the craniotomy, they'll just kind of do like a little burr hole and just drill in and then let that pressure get released. And then whenever we talk about fractures, again, you'll see all of that whenever we get to it. Those are closed reductions versus open reductions. External fixation. I don't know if you guys have ever seen where they have like the hardware that comes out, and that little silver piece, that titanium piece, that's going to be your external fixation. Or in like having traction, where they have the leg up in a sling and then their toes are actually like held with like the little strings, and that pulls that traction. So if you have a compressed fracture where your bone is typically like this, but the compression actually makes the bone overline, they can use that traction and gravity to basically put it place and then put it back. And then our word root for bones and joints. So osteo is going to be bone. That's the one that you'll see majority of the time. Myelo is going to be for your bone marrow. Chondro, so a chondroblast, we talked about those. It's that cartilage forming cells. Arthro is for joint, and then synovial is going to be for that synovial fluid. So someone that has asynovia, it just means that they are lacking that synovial fluid. I'm sorry, I was trying to look and see what time it was. I didn't realize my thing covered it up. And then word root for the skeleton. So the first one was just the bones itself, but this is actually like for the skeleton. Cranio is going to be for the skull. Spondylo is for vertebrae. Vertebro is for vertebrae as well as the spinal column. Reiki is going to be for the spine. So Reiki schisis is going to be a fissure of the spine, or what's also known as spina bifida. Costo is for the ribs. Sacro is for the sacrum. Coccygeal is for the coccyx. Pelvio is for pelvis, and ilio is for the ilium.